Good day, everyone. I'm Dr. Yasmin Gamal, Associate Professor of Pediatrics and Clinical Nutrition at Ain Shams University, and Director of Children's Hospital at Ain Shams University. I'm a Year 1 Famer Fellow 2023. My advisor is Professor Randa Rida, and I would like to introduce my project, Developing of a Training Program for Nutrition Screening and Assessment of Pediatric Malnutrition for Interns in Children's Hospital at Ain Shams University. So what is known that in my country that we have high malnutrition rates among children in our community due to the lack of early detection and screening by healthcare professionals, whether because they are overwhelmed or they lack the knowledge for early screening and detection of malnutrition, which leads to increased health costs and affects the health of our community. Nutrition education, including screening and assessment, is missed and lacking in medical school graduates and postgraduates, and interns are considered a primary setting for implementing nutrition education programs because this is a training year for them, and this is a good chance that they will be able to uh, implement this program in their practice later on. What is new is that we aim to develop and implement a training program focused on nutrition screening and assessment of pediatric malnutrition for early detection of malnutrition in children. The goals of my project are to increase the knowledge of pediatric nutrition screening and assessment among interns, increase their skills in using screening tools and proper anthropometric measurements to early detect the malnutrition problems among children and prevent complications, and early intervention of malnutrition would lead to decreased health costs in the hospital and better health of children in our community. What we tried so far is that we developed the program, a one-day training program for nutrition screening and assessment by a team of pediatric nutrition experts. We obtained the IRB approval of the hospital and formulated the training team. The training program was conducted at the beginning of the intern round. We conducted 3 rounds so far, and interns were evaluated by pre and post questionnaire and an OSCE exam after they completed the training done in the outpatient clinic in the Children's Hospital at Shams University. Regarding the budgets, all resources were available regarding the team, the staff, the faculty, the equipment, and administration for the projects as a part of the intern training program in Children's Hospital. What we achieved in year 1 is that we formed the training team, we developed the training program, we obtained the approval for our project, and the first batch of interns that we applied the training program on was in May 2023. 3 batches of interns were trained so far because the intern rounds are every 2 months. The lesson learned during these months is the importance of continuous course evaluation and assessment. We had to change the content from the first to the second batch and the second batch to the third batch regarding the content. Continuous feedback is mandatory for updating the content, and we had to always find new learning strategies to keep the instructors, the faculty, as well as the student engaged in the training program. The success is that we were able to develop and implement the program on 3 rounds so far with positive feedback from the faculty and interns. The challenges that we are facing is keeping the team always engaged, keeping the faculty and instructors always engaged to implement this program, trying to involve as much interns as possible, and to implement it in a setting with a large number of patients was really challenging for us. What's next is to continue implementation of the program for the next year because there were good feedback regarding the interns and the faculty and the effectiveness of this training program and how it increased their knowledge and skills regarding pediatric nutrition assessment. We have to update the content based on the feedback, continuous process, continuous assessment, and measuring the next year. I aim to measure the impact of this training program on the early detection of malnutrition in the hospital, comparing next year with this year. I would like to acknowledge Professor Randa Rida, my advisor, for her continuous support, Professor Manan Hamdi Said, Head of Pediatric Department, for her enthusiasm and continuous support, Professor Marwa D, Professor Maha Zakaria, the intern coordinators who were supporting me all through the training and the assessment of the interns, and of course, my colleagues and professors in the pediatric clinical nutrition unit, for they are the core and the pillars of this training team regarding the interns. And thank you.
We'll be highlighting 10 ways